Good morning, good morning, good morning, and welcome to this beautiful day again on WUFO 1080 AM, Power 96.5 FM, or you might be streaming. So thank you for streaming through your favorite streaming services. My name is Francesca Messiah, manager community improvement here at Kaleida Health. And I just want to say thank you again for listening to our program. Thank you for telling your friends to listen. Thank you for tuning in on YouTube. And when I see you in the community, thank you for letting me know that you listen to the program. And remember, I've been doing this for a few years. I will always ask the question, is there another topic? Is there a topic that you would like to hear? All right. Just a little bit about who is Kaleida. This is Kaleida in a snapshot. Kaleida, we are the hospitals. We're Buffalo General Hospital, Gates Galisano Children's Hospital. We're the emergency department at DeGraff Medical Park. We're Millard Fillmore Suburban. We're Gates Vascular Institute. We're Olean General Hospital, and we're Bradford Regional Hospital. We're also long-term care. Who are the long-term care? Matter of fact, our guest today, Angela, is from one of our long care facilities, and that is High Point here in Buffalo on the corner of High and Michigan. Also, we have DeGraff long-term care, and that's in North Tonawanda. We are also located in several of the Buffalo Public Schools at the school-based health centers. We also have clinics north and south of Buffalo for women, children, adults. We have specialty clinics for orthopedics. We have weight loss specialty clinics. We have specialty clinics for cancer patients, persons who have been diagnosed with cancer. We have specialty clinics as well. And it's just a snapshot of who Kaleida Health is. And we're also Western New York's largest healthcare system. Well, our guest for today, we haven't talked about careers in a while. And our for today is Angela Moster, who is a senior talent acquisition partner. What does that mean? Angela, good morning. How are you?
Good morning, Francesca.
Oh, so I'll let you tell instead of me telling the
Yeah.
listeners what is a senior talent acquisition partner?
So my name is Angela Mostler. I'm the Senior Talent Acquisition Partner for both of Kaleida's long-term care facilities. As you mentioned, High Point on Mission and DeGraff Skilled Nursing Facility. So my job role as a Senior Talent Acquisition Partner is to work closely with managers and place applicants and new hires in their prospective positions. So I pretty much seek out the talent and work with the managers on where would be a good fit for these applicants that apply for the organization.
And you're well, today's topic, listeners, I didn't introduce today's topic. Today's topic is getting your career started as a certified nursing assistant. And why did I choose that CNA, certified nursing assistant? Because that's what Angela is responsible for. And Angela, are you a nurse?
I am not a nurse.
Okay. Well then share with the listeners, how did you get your career, how did you get started in your career working in long-term care, and especially with the certified nursing, with the CNA employees?
So I actually started my career in healthcare as a certified nursing assistant almost 28 years ago. And becoming a certified nursing assistant opened up plenty of opportunities within the healthcare field and finding exactly what career path I wanted to follow. So, becoming a certified nursing assistant introduced me to different positions within the healthcare industry until I found my niche, and my niche was in human resources.
Oh, wow, that is great. And so as the Kaleida Health hiring, as you're the hiring person for the CNA, not only CNAs, not only at High Point on Michigan, but also at DeGraff. Um, and there are two different sites. Now, is it the same position? I mean, does the position look the same? Although because one's in Buffalo, one's in North Tonawanda. Is it the same position or something slightly different about being at different sites?
It is a little slightly different. New York State certified nursing assistants, take care of other people. However, our facilities are very unique. High Point on Michigan is a very unique healthcare facility where we not only specialize in adult patient care, we also specialize in servicing children as well. So, High Point on Michigan has a 20-bed pediatric pavilion unit where we service children anywhere from just a couple months old to 21 years of age. We also have a 20-bed adult vent unit. We specialize with medically complex patients and residents, and we also have dementia as well, along with other long term patients that we care for. Now, DeGraff Skilled Nursing Facility, which is located in North Tonawanda, is for the elderly population only.
Oh, interesting.
For adults.
So, yeah. So for the 20 bed vent unit, dementia, and the children, do our CNAs part of all of those levels of care?
Yes. So the certified nursing assistants at High Point on Michigan have a wide range of patients and residents that they actually take care of, where DeGraff is mainly just adult population.
Hmm. So if someone is interviewing for the position, would they tell you in advance that they are interested and that they don't mind working in all the different areas, or do they just say, I just want to work with elderly?
Yeah, those who actually have a passion and became certified nursing assistants have a passion of taking care of others. So some of them are very excited to be able to work with the children that we have here at the facility, but the other ones are always willing to learn.
Oh, good. That yeah, willing to learn. That's what life's about.
Absolutely. But we do train all of our certified nursing assistants to work throughout the entire facility in the event that they ever have to take care of any of the patients that we have here.
So you said you train, but do they first have to be pass the CNA certification with all the hours? And really, let's just talk about the qualifications for becoming a CNA.
Yeah, absolutely. So for the qualifications, you know, it's a great thing about the great thing about becoming a CNA is that it's one of the most accessible entry points into a healthcare career. In most cases, individuals need to have a high school diploma or a GED or be working towards one. However, we do offer a reading assessment in lieu of those credentials, and they must meet basic health and background check requirements that's established by the state and Kaleida, the employer. Many training programs allow students to begin exploring healthcare careers while they are still in high school, depending on the program and the state requirements. So, students can often start CNA training as early as 16 or 17 years old. And Francesca, you know that we have partnerships with schools where we allow the students to come into the actual organization and practice their clinical skills with our patients and residents. So that gives them an incredible opportunity to gain hands on experience and begin building a career in healthcare before they even graduate. So the CNA training program typically includes classroom instructions, skills training, supervised clinical experience, and that's all designed to prepare the students to provide safe care to our patients and our residents. So after completing the training program, candidates take the state certification exam to become certified in order to practice and practice and working as a certified nursing assistant. So what I love about the CNA pathway is that it opens doors. Many CNAs go on to become licensed practical nurses, registered nurses, or move into other healthcare professions. It's not just a job, it's often the first step in a long and rewarding healthcare career, which is the path that I followed once I had became a certified nursing assistant.
Mm-hmm. Mm-hmm. Something that I know I didn't really understand until I started, working in HR. You talk about the students coming in or not coming in, but you have to still practice clinical skills. What does that mean? I used to always act like I knew what it meant, but for but for someone who doesn't know, what does that mean? Practice clinical skills.
So the classes are it's a classroom setting, and they're there with their clinical educators learning all the techniques, all the procedures that's needed to be a certified nursing assistant. The clinical allows you to step outside of the classroom setting and actually go into action and do the hands-on care of everything that you learned in the class.
But you're not doing it on your own. There's somebody who's working with you, correct?
Correct. The clinical educator is always with the students while they're doing their clinicals. So they're
Okay.
there monitoring them and supervising them while they're doing the patient care.
Now you talked about if someone, let's say someone is attending, because you have open hiring sometimes, right? Is that what it's called?
Yes, recruitment events.
Recruitment. So you can attend, and if you pass what's called the reading assessment, you can begin your career path as a certified nursing assistant.
Well, we do the recruitment events for the paid CNA training program, and we offer the reading assessments in lieu of the diploma. So if they don't have a high school diploma or a GED, then we provide them a reading assessment that they can complete in order to make them a potential candidate for the CNA training program. So you do not have to have a high school diploma or a GED, but as long as you pass the basic reading assessment, then you're able to apply for the position.
Mhm. And I also believe once you're in the Colitis system, there are different classes where you can complete your GED. So that's also a bonus. I believe that's so, right?
Yes, we Kaleida also has partnerships with different programs and other organizations where we encourage our employees to go ahead and further their educations by providing them with the programs that we have in hand for them.
Yeah, thank you so much. Um, so what does a job training look like? So if someone's coming in, let's say they have their CNA license already, would they still go through the job training, or is job training for someone without the license or certificate?
We're always providing job training. Even if you do come in as a certified nursing assistant, Kaleida has its own policies and procedures where we would like to teach you the Kaleida way. So we're always, regardless of years of experience, Kaleida is still going to do on job training just to make sure that you have the tools that you need in order to be successful in their role.
Okay. So qualifications on becoming a CNA. I know a couple of high schools do offer it. So what are some of the qualifications that you have to have?
The qualifications to go into the CNA training program or to become a certified nursing assistant?
Let's say both. Let's do the latter first. Let's do the latter first.
Right. Well, for the qualifications to become a certified nursing assistant, you have to go through the actual classroom training. That's mandatory and that's a must. So you have to do the classroom training. You have to have the credited amount of hours in order to complete the program, which involves the clinical training as well. Once that has been completed and you fulfill that, then we start preparing you for the New York State exam. And once you take the New York State exam, then you become certified within the state of New York to go ahead and practice to be a certified nursing assistant.
Okay. And that can start like when you're 16 years old, you said you can start
Yes,
training.
there are programs out there within schools that they have students training as young as 16 and 17 years old. Here at Kaleida, you must be 18 years of age.
To work.
Correct.
Yeah. So
And
don't
to
get
enter,
discouraged.
yeah, and to enter the CNA training program here at Kaleida.
Yeah, so I'm just saying that to our listeners, you might be 16 years old going through the program, 17 when you graduate, but normally within a few months you're 18 years old. So if somebody wanted to contact you and has a question about everything we're talking about thus far, how what would they do? How would they contact you?
Well, they can contact me on the Kaleida's careers page. My email information is on there. It's armosteller@kaleidahealth.org.
And could you spell master like yeah, how do you spell that?
It's ARMOSTILLER@kaleidahealth.org.
Thank you. Um, Now, what once hired, are CNAs, this is what I hear. I hear this question a lot in the community. Once hired, are CNAs able to receive overtime? And what about the schedule? So let's talk about okay, so you're hired, you're working at Kaleida Health, and you're 18 years old, 19 years old, and can I receive overtime? And how about flexibility of the schedule?
Yes, absolutely. So, one of the advantages of working as a certified nursing assistant is the flexibility that comes with the role because healthcare operates around the clock. It's a 24-hour, 7-day a week, 365 days operation. So, CNAs often have a variety of scheduling options available, including working day shifts, evening shifts, overnight, weekends, full time and part time shifts. So, this flexibility can be especially helpful for individuals balancing family responsibilities, such as school or other commitments that they may have. So, many employers also offer opportunities for overtime for employees who are interested in working additional hours. So, for CNAs looking to increase their income or gain more experience, overtime can be very valuable for them in continuing to provide essential care to the patients and the residents. You know, healthcare, especially Kaleida, understands the importance of work life balance and strives to create schedules that meet both the needs of the facility and the employees as well. So the goal is to provide flexibility while ensuring the high quality of care for those that we serve. So for many CNAs, the combination of flexible scheduling, overtime opportunities makes this career both rewarding and practical for them.
Wow, that was a lot. That was a lot that you said there. How long is a shift?
Our shifts are 7.5 hours, but we also have 12-hour shifts available as well.
And what does a 12-hour shift look like? What are the hours for that?
Yeah, so for our pediatric pavilion unit, everyone that works on that unit works 12-hour shifts so that we can make sure that we have the 24-hour continuity of care for our children. So for those who work with our children, work from 6 a.m. to 6 p.m. and from 6 p.m. till 6 a.m. Those are the actual 12-hour shifts. We also have 12-hour shifts on our adult vent unit as well. And those hours are from 7 a.m. to 7 p.m. and 7 p.m. till 7 a.m. again for that 24-hour continuity of care. For the other shifts that we have available are 7.5-hour shifts. Those shifts are from 7 a.m. till 3 p.m., 3 p.m. to 11 p.m., and 11 p.m. till 7 a.m. And every other weekend is mandatory as well.
Wow, but I mean that's a lot. But again, the good part is that you can put your child or grandchild, foster child neighbor's child on the bus, go to work,
Absolutely.
and then take turns, and then hopefully then somebody can make sure that they get off the bus safely. So I mean, the flexibility is it's amazing. The flexibility. If you're working a 12-hour shift, I'm just asking, do you get a longer lunch break, or do you get two lunch breaks or dinner breaks? How does that work?
Yes, you do have the breaks available for lunch. And again, the best thing about working for healthcare is the flexibility in the actual schedule. So those who work the 12-hour shifts do get extended breaks and lunch breaks.
Yeah. So you're not there I mean, you definitely have downtime where you can make a call if you need to, I don't know, call and pay up the parking ticket or something. I just say that, or make a call about your health insurance. So there is time, personal time during those 12 hours too, for that where you can get things done or talk to your family member if need be. Career option. We talked a little bit about CNA career option, and I just went online looking at some things. You talked about LPN, RN. What are some of the other career? Do you have to stay in? Let's say you're a CNA, it's been a year or two, and you realize that's not really what you want to do. What are some of your other options?
So we have plenty of options. Again, not only do we offer them a job, we offer plenty of career opportunities. We have a tuition assistance program that's provided through Kaleida Health for those who want to further their education. So, it's an endless career ladder within the organizations, but many CNAs choose to advance their careers by becoming licensed practical nurses, registered nurses, and others pursue opportunities such as certified medical assistants, whatever it is that Kaleida has to offer, behavioral health roles as well, infection prevention and control, and explore different, a whole bunch of different avenues within the healthcare field that they're interested in. So we believe strongly in investing in our employees and supporting their professional growth. So we encourage them and motivate them, inspire them to, take advantage of the tuition assistance programs and the educational support that our team has for those certified nursing assistants to achieve their career goals.
Yeah, and besides Angela saying it, I was working with the program, the LPN assistance program, and that was for persons interested in LPN becoming a licensed practical nurse who work for Kaleida. And my point for saying this is that once you're in the healthcare system, you might be a respiratory therapist and say, you know what? I want nursing. And as Angela said before, there are programs within the Kaleida system that will pay for you to then if you want to become a nurse or vice versa. So there are so many career tracks that being starting off as a CNA, it just opens that door. It's a door opener for you. Terminology. How much medical terminology is part of being a CNA?
Many.
Yeah.
There's many medical terminologies, which is all
Uh-huh.
part of the on the job training, from meal intakes to, the patient's vital signs and doctor physical therapy orders, respiratory therapy orders. So lots of terms that our certified nursing assistants have to learn when working in this role.
Yeah, and I want to say that when I worked with the high school students, I used to tell them, you're going to be the medical person in your family. Everyone's going to turn to you because you know the medical terms that I don't know, and not all your family members know. So I just want you to know that it's an extensive vocabulary that you'll learn, just like the nurses and doctors and PAs and nurse practitioners. Open hiring, anything coming up?
We don't have any set dates at this time, but we are doing a recruitment event this Thursday at DeGraff Skilled Nursing Facility, which is located in North Tonawanda at 445 Tremont from 11 a.m. to 4 p.m. We're looking for licensed practical nurses and New York State certified nursing assistants for our evening shift. The shifts over at that we're actually interviewing for at DeGraff are from 2 p.m. till 10 p.m.
Okay. And now anything you want to add? We have a few minutes left in the program, something that I haven't covered that you want our listeners to know about the greatness of being a certified nursing assistant, or as we call it, a CNA.
Yeah, absolutely. You know, being a part of inspiring those to become a certified nursing assistant is where we implemented the paid CNA training program for those who are interested in becoming a certified nursing assistant. I had a passion for taking care of others, but at the same time, as I grew into my career in human resources, I wanted to inspire others to make a difference in people's lives. So CNAs are often the people spending the most time with the residents and the patients, providing them comfort, compassion, and hands-on care during some of the life's most vulnerable moments when it comes to our patients and residents. So that inspired me to focus on supporting and growing the CNA workforce. Throughout my career, I've had the opportunity to recruit and train and mentor individuals entering healthcare for the first time and actually help create pathways for them to become certified nursing assistants. So, this paid CNA training program is near and dear to me. One of the things I'm most proud of is helping develop the program that removes barriers to entering this profession. And that's including the paid training opportunities and partnerships that we made within the actual community to get this program up and running. It's a rewarding position, and it's also rewarding to watch someone come into the program looking for an opportunity and then see them grow into a confident healthcare professional and making a real impact in their community.
And Angela, something you said, and we have like less than a minute left. You kept using this word paid. Are you saying you get paid for training and then you move into a job all in the same place?
All in the same place. It is a paid training program, so we're actually paying you, we're providing you a paycheck to come to the classes. And once you complete the actual program, we transition you into a permanent position here at Kaleida Health.
Thank you. Thank you, Angela, so much for being our guest this morning on the Great Lakes Health Radio program. And listeners, I just want to say, hold on. Our next guest, something we were talking, it ties in a little bit. It's talking about rest. So our next guest, Dr. Adams, will be talking about rest. And I think one of the questions I'll ask her, if you're working a 12-hour shift, how do you get proper rest? It's because Angela just talked about the different shifts. So I always like to make sure our programs are tied together. Angela, thank you so much for being our guest this morning.
Thank you so much for having me. It's always a pleasure.
Yes, you too. And have a wonderful day. And listeners, give me 10 seconds for the next program to begin. Thank you. Francesca Messiah, Great Lakes Health Radio program, Kaleida Health. And now on to part two. Good morning, good morning, good morning, and welcome back to the Great Lakes Health Radio program here on Power 96.5 FM, 1080 AM. Or you might be listening to the Great Lakes Health Radio program on one of your streaming services. My name is Francesca Messiah. I'm the manager of Community Health Improvement, and I welcome you back, or glad you're tuning in. I'm not sure what time you began listening to the program, but I tell you, I definitely appreciate you listening to the program. And today is a part two. I had mentioned a few weeks ago, well, when Dr. Christine Adams, who is our guest today. Good morning, Dr. Adams. How are you?
Good morning. I'm doing great this morning. Thanks for having me again.
Oh, good. And Dr. Adams is a physician, and she is the Chief Wellness Officer at Kaleida Health. And Dr. Adams, when I was looking up your title, um, you're in the emergency department, right?
Correct.
And there's a term that means you work the nights, so everybody else who doesn't work nights has the days off. There's a special
Correct.
word for that, isn't it?
Yes, it's called nocturnist. Yes.
Nocturnus. Yeah. I had to go into Google, Dr. Google, and say, what's a nocturnist? And I said, wow, okay. So you've dedicated your life to working evenings, it sounds like.
Yeah, I have worked the night shift for actually 21 years on night shifts.
Oh
Yeah.
my gosh. Well, today's topic is the importance of sleep. And it's a part two from where we would had talked before. And my first question, Dr. Adams, where did your interest begin with studying sleep, and why is sleep important to our health?
Yeah. Yeah. Well, I think how we started, right, that I've worked the night shift for 21 years, made me realize, a little bit of the study, it's the practice, it's the manipulation of sleep, right? Basically, starting my career in a state of sleep deprivation. And a lot of physicians do, and a lot of students in general, whatever level of higher education. We've heard of pulling an all-nighter, right? People do that in
Yes.
college. So,
Yes.
recognizing that my practice started in sleeping in the opposite circadian rhythm, the anti-circadian rhythm, if you will, really made me pay a little bit more attention to sleep in general and how to manipulate that. How do I function on the flip side? And how do I get the rest, when everybody else is, I affectionately call the day walkers, right? Like doing the things during the day when you're supposed to, when nature intended. So that's where I started to pay attention to it. And then as I developed my practice in the um, realm of wellness or personal or physician well-being, really recognizing how integral that is in being able to perform at your highest and best level and how it really affects your well-being. So that's kind of how it naturally evolved in my own practice of medicine and life.
Yeah, and I always say to people, I mean, between, fire, police, ambulance, and hospitals, there are not many positions or careers that are 24 hours. And like, and people are like, oh, you have to, it's a holiday. I said, a holiday. I said, have you ever come to the emergency department on Christmas Day? And there's a sign on the door that says, we're out. We'll be back in an
Exactly.
hour. I'm like, it's one of the
Exactly.
professions like police and fire and ambulance that are, 24 hours. But so why is it then important to our health to get rest, and how much rest? So many studies.
Oh my goodness. Yeah. And that's a thing. So and a lot of people want a hard and fast number, and there's some generalizations, but really the reply is it isn't a lot of things in medicine and sciences. It depends, right? And even for me, people say, how could you have done night shifts for 20 years? Well, I'm okay with it. And not everybody is, right? So, it depends on, and everybody, even there's variability in what an individual body needs. So we can say you need 8 hours. You can say if you're less than 10 years old, you need 10 to 12 hours, right? As we get older, we require less sleep, right? And I think there is individual variability. So there's a lot of guidelines, and you can take it, and then you can adapt it, you can customize it or personalize it, if you will, right? So I think that's a question that people love to ask, and I really do think it depends on what you find you need, and that's a little bit of the scientific method of trying, what works for you, and when you do a thing, how do you feel when that happens? And if you don't do well, maybe you needed more, right? So we can follow some of the guidelines that all of the studies look into, but there's a little bit of personalization. There's a little bit of customization to each individual.
Mm-hmm. And a question, and why, and not having children, but why do they need more sleep?
Yeah, well, that's because of neurodevelopment, right? Like that's really where your brains are growing and learning and adapting, and that's a little bit about um, one of the benefits of what happens when you sleep, right? What happens to your brain, and it's neurology, right? There's a little bit of memories and things that happen, synapses, those nerve firings, right? Things that you learn. Those things are amplified when you sleep. When you get into that deep sleep state, your brain is able to really solidify the things that you've learned and done during the day. And during the day, there's a lot of other things stimulating your brain. So when you sleep, you're able to kind of really replay those things and basically taking some of those temporary things that you've learned in your brain and turning them into permanent neurosynapses, right? So these learned behaviors. So when little ones are learning and growing, when they sleep in that development brain, they're able to have more of that impact of really developing that. And there's a little bit of structural remodeling too in the brain. So there's hormones and there's a lot of brain chemistry stuff happening in sleep, and it's very effective and most prevalent during sleep.
Wow. I mean, growing up, we had to take naps every
Yeah.
day, even on Sundays. And I remember my mother used to call my sister Sleeping Beauty because she could sleep for like a couple hours.
Yeah, that's a blessing, right?
That
That's a
was
blessing.
even as an adult, she was a sleeper. So so you talk about memory and that and sleep is good for our memory, meaning that if we have a good night's sleep, we can probably remember more of what we did the day before, something like that.
Absolutely. Absolutely. And I tell people that all the time. Like, I can be so clever and articulate when I've had good sleep. But if I'm coming at the end of a night shift and I've only gotten a handful of hours, we encourage people, do not make big decisions at that time. Do not do critical thinking at that time until you get some sleep, right? So, and that's true. When your brain, gets into deep sleep, then there's something called the glymphatic system, and it basically is like the wash, rinse, and repeat cycle of your brain, and it helps wash out that fluid that surrounds your brain, helps wash out some of the metabolic waste of the day, of your day to day, and the things that your brain accumulates while being awake. So you're able to rinse those kind of waste byproducts out, and it helps your brain recover. So you have a better ability to process. And again, there's those neurotransmitters, there's those nervous synapses that fire better when they've been cleared out of all of that excess waste, metabolic waste that accumulates throughout the day.
Okay. Well, something along that line. So, reading the literature, getting ready for the program, it talked about sleep clearing out toxins. So, what you just mentioned, are those the toxins that the literature is talking about?
Yeah, and when it's toxins, I think you have to be a little bit careful of it's not like something that you ingested. It's not like a poison that you've been exposed to. It's really kind of a metabolic byproduct. So kind of a normal process of your brain functioning and being, a productive member of society or just your day-to-day activities. There are normal byproducts. Just like if you worked out in your body, I know Fran was talking about working out and other things, other parts of your body, other organ systems create a byproduct of just functioning. Same with your liver, same with your kidneys. The brain does too. So, you know, I caution using the word toxins because to me, toxin is a poison, right? Um, but it really is. There's a normal metabolic byproduct of just functioning. So it's not even that you did something wrong or you ate something bad or you didn't do the right things, you didn't take the right vitamins. There's normal byproducts of just a functioning organ system that need to be washed and repeated, right? You need to flush your kidneys, you need to flush your liver, you need to, wash your skin, you need to pump blood through your heart. Same thing goes for the brain. And the fluid that surrounds your brain is affected by many things, and sleep is one of the things that helps the normal fluid that washes your brain really do its job. And so it's flushing out those metabolic byproducts that accumulate just from normal life and then kind of lets you refresh and reset for the next day.
Wow. I've done a lot of programs, and I don't think I've ever had a program where we're talking about fluid around the brain. Although I'm familiar with it, but that's okay. Um, how about, can you briefly address sleep and overeating and appetite? Like sometimes when you don't get enough sleep, you just want to keep eating. And my hand is raised because sometimes that happens to me. The other day I caught myself doing it. I forgot what I wasn't eating. I shouldn't have been, probably some chips or something. And I said to myself, "You're eating like this throughout the day because you're tired. Why is it that when we're tired, we want to overeat?"
Yeah. And that has to do with, so that's two organ systems. So that's the neuroendocrine system. And the endocrine system is your hormones, right? So when you're sleep deprived, your brain leans into that hormone system, the endocrine system, and is like, keep me going. How do you keep me going? Right. And the
Right. How do I
brain
stay
needs
awake?
energy. Yeah.
Right.
Well, your brain never really goes to sleep. Like it doesn't turn off, right? Same thing. Your heart doesn't stop beating when you go to sleep. Your brain can never really stop, but the functions of the brain change when you sleep. So when you're now not getting that restful time for the brain to kind of relax and shift gears, it's staying in overdrive. Now it's leaning into the endocrine system. So these hormones to help keep it going. So when you're sleep deprived, the brain signals that hunger hormone and it keeps your appetite going because the brain needs to go. So now it's signaling that hormone to keep you eating. It also reduces the hormone that makes you feel full. So your brain's doing it to yourself, but it's doing it for survival, right? You're in survival mode. That's another hormone that's stimulated. So people know that stress hormone, cortisol. We might have talked about that last time, right? You're in overdrive now. So your brain is stimulating that stress hormone. Keep me going, keep me awake. I got to do these things. And that's what makes you eat, right? So the hormone that makes you feel hungry is pushed. It's the brain's pushing that button. The hormone that makes you feel full, brain's turning it off. And the hormone that's driving you, that stress hormone, also stimulated as well. So it's really not just your brain, it's your brain recruiting other things to help your body keep going without that sleep and rest that it needed.
Oh, so complicated. But anyway,
It is.
it
We
is
are magnificent, complicated machines, the
oh
human
my
body,
gosh.
right?
Yeah.
Um,
So I
yeah.
have a question. We kind of talked on it, but in this conversation, um, who needs the most sleep? Is it babies, children, teens? I've heard teenagers need sleep. Is it adults? Is it seniors? Is there anyone who benefits the most from sleep, or is it all of the above?
Yeah, I mean, I would say that's also one of those that it depends, right? Everybody kind of needs a different amount of sleep. And just like I said, I'm definitely not a baby or teenager anymore, but if I'm going to a high impact, intense thing, be it a night shift in the ER or some big meeting where I have to make a big decision, I need more sleep before that if I really want to be highly functioning and at my best. But if you're breaking it down to just the science of it, it's really those developing brains definitely need that sleep, right? They need that process so they can develop properly, but it really is universally critical, right? You could say, well, if I'm retired and I'm not making any important decisions, do I really need as much sleep? Well, that also depends, because sometimes just your day-to-day functioning, if you're a little bit less coordinated when you're tired, well, when you're an older person, you don't want to be less coordinated, because then you're falling and hitting your head and breaking a hip, right? So it is universally important, but it's important for different things, I think, at different stages, right? So those young developing brains, absolutely, sleep is a priority so that they continue to have that proper neurodevelopment. But I would say everybody needs it equally. It's just what their critical indicator for sleep is might change over the course of our lives, right?
Yeah. So then, okay. So then, why is it someone? Maybe I don't know. I'm not going to guess. So if someone is over 90 and they seem to be sleeping more, is that just because they don't have as much to do, or is that just a natural part of aging, or is it
Yeah.
just a natural part of aging?
Yeah, I think that's different. That's a different story when you
Okay.
get to that. I think it is part of aging, and that's a whole metabolism question, multiple organ systems, right? So now we're talking about your cardiac output, you're talking about your respiratory. So some of those other organ systems take more energy. It takes a little bit more exertion to do things that used to be easy for you. So now there's more fatigue, right? So that is a complicated question, and I think the answer is you could probably more easily describe that as yes, it is a normal part of aging. Um, could there be a boredom factor? Possibly,
That's
possibly.
true. That's true because
But yeah.
yeah, yeah, you don't necessarily have as many friends around it. You may or may not. Sorry. Melatonin. I have a friend who swears by that. She says it helps her sleep at night. Is it true?
Yeah, so that's a great question, and that's something that people use. So melatonin is a hormone that you naturally produce in your body. There's a gland in your brain area that naturally produces it, and it's in response to darkness. So I used to joke, working night shifts for 21 years, that I am resistant to melatonin, or I don't make melatonin, was my joke, right? Because I function in the darkness. I don't produce the sleep hormone in the darkness, right? So that was my joke. But really, what melatonin naturally does is it helps you establish that circadian rhythm, right? When your body produces melatonin, when it gets dark, it's telling your body it's nighttime now, it's time for sleep. So when people take melatonin, I think a little bit of the um, misinformation or misunderstanding is it's not a sedative, it's not a sleeping pill. It is a supplement of that hormone that your body is already making to tell you to go to sleep. So melatonin works sometimes, and so there's multiple layers to this answer. Is I think sometimes there's a little bit of a placebo effect. I'm taking this pill makes me go to sleep, and I'm going to sleep. The reality is it's over the counter and it's not regulated by the FDA. So the doses can vary. So it's hard to say, are you getting a dose that's really stimulating your body to recognize that it's nighttime and time to go to sleep? Hard to say. But it's really not a treatment for insomnia. Again, it's that natural hormone that your body should be producing already that helps your brain recognize it's nighttime and it's time to go to sleep. So what it does is stimulate that circadian rhythm. It's not a sleeping pill. If it works for her, then that's great. And maybe she needed that little extra bit in addition to what her brain naturally makes. So it's a mixed review on whether melatonin works or not.
Yeah. Is it something you can overdose if somebody were to take like 4 melatonins or something over the amount? Will it help will it help? Will it harm them, I should say?
Yeah. And that's also, I think, taking anything in excess is always a concern for harm. But it's again not that metered dose because it's hard to say what's actually even in it. So yes, I would say do not overdose on that because you don't really know the actual amount that's varied in that pill. And actually when you take a pill, what it says on the label, maybe not what they actually find if you break it down and study it in a lab too. So hard to say what you're actually taking. So I would always suggest to never take more than what is indicated on the packaging for sure.
But before I ask you anything else you have to say, I have a quick question. So, sometimes you, let's say Monday, Tuesday, you don't have a good night's sleep. And then Wednesday, you have a good night's sleep. Why is some nights you have a good night's sleep and then other days you're tossing and turning? Does that have anything to do with, or what does that have to do? Like why is that sometimes?
It's usually multifactorial, right? And so um, there are and to kind of lean into that, the things that you can do to improve your sleep. So sometimes it's related to those stress hormones that you have. So things that went on in the day that are kind of running through your brain when you're going to sleep, the ability to kind of clear your mind, get into that mental state of going to sleep. Sometimes it's related to actually temperature is a big thing that helps you get into a good state of sleep, and you really want that cooler temperature, right? Things to help cool your core temperature. Besides the, you say, air conditioning or the heating in your home, like there's things in your body, which is why you I don't know if you've done any segments on menopause or things like that, women who have hot flashes, people who are sick and have a fever. When your core temperature goes up, you wake up, you don't get proper rest, right? You need that body temperature to cool to help you get into that better state of sleep. The darkness affects your sleep, right? So if it's dark in your room, I call my bedroom a bat cave. It's the walls are painted dark. There's all kinds of darkening window coverings. So I don't let that light stimulate my brain and tell me it's time to wake up. So there's a lot of factors. Caffeine consumption also, when you last drank caffeine or eating caffeine, people don't realize the
Right,
other
chocolate.
yeah. So when you're eating and when you get that hot fudge sundae before bed, how much caffeine is in there? I don't know. I didn't measure, but it was delicious, right? But maybe now I'm sensitive to it. Maybe I'm stimulated a little bit longer. So it's multifactorial of why you do or do not get a good night's sleep. So to that point, really establishing a pattern helps you get most consistent and effective sleep. Travel too, changing time zones, right? Really disrupting that circadian rhythm. Yeah, and that's back to that point of melatonin. That's a study that they show melatonin really is effective to help you with jet lag, because when you've messed up your circadian rhythm by changing your light exposure, changing your time zone, melatonin can help you shift back. There are studies that show that it helps you reset your circadian rhythm, getting you back in your current time zone, to help you with sleep. So there's a lot of things that can disrupt your sleep cycle. And I think the important thing for us is, as you know, humans that like to worry about things or stress about things, is to recognize, okay, I had bad sleep, and how do you move past it? Because if I'm dwelling on it, right? Oh my God, I didn't get to sleep. It's late. I didn't get to sleep at the time. And now I'm not going to have enough sleep. And now I'm going to be grumpy tomorrow. I'm not going to do well in my meeting. I'm not, blah, blah, blah. And then you just go on and you don't let it go. Now you've really disrupted. Now you're really not letting your brain get into that deep sleep mode, that wash, rinse, repeat mode. And you've really done it. So it's kind of similar to nutrition, right? I have a bad day. I ate junk food all day. I didn't work out today. Like, I know we've talked about that before, is allowing that and kind of acknowledging it. Oh, it was a bad night. I stayed up too late. I maybe drank alcohol. I maybe had too much caffeine, and now it's disrupted my sleep. How do I reset for tomorrow? How do I get back to that pattern? How do I get back to those ideal environment and circumstances to reset and have good sleep the next night?
And for listeners to understand all the different desserts that have caffeine in them.
Oh, yeah.
I've learned the hard way, but just kind of when you go out, a lot of desserts have chocolate in them. So
Yeah.
and it's masked. We have 2 minutes left. So what are some of the closing thoughts you would like for our listeners to put in their learning box about
I
sleep?
would, yeah, I would say, don't minimize the positive effects of good sleep, right? Really recognize we tend to strive to do more, produce more, be more involved, and recognizing that giving yourself enough sleep really helps you show up to those things that you want to be present for in the best version of yourself, right? Don't minimize the impact of that. That being said, also, perfection is an illusion. So do your best, right? Baby steps, making a couple steps here or there to optimize your sleep environment. Your sleep hygiene is another thing it likes to be called, to really make you recognize this is something that's helping you be the best version of you, and do your best with what you got, right? And recognize I might not get good sleep tonight because I have a late meeting or I have a late event and I have an early day, and that's okay. You'll get back to your good practices as soon as you can. It is important. Give it the value and the weight that it deserves. And then, be kind to yourself. Be kind to yourself when sometimes it's not going to be the best that you want it to be. And that's okay. Do the best that you can the next opportunity you've got.
Yes, and on that note, I'm going to say you want to show up, and so you don't show out.
Yes,
And
for
those
sure.
know. So, Dr. Adams, Chief Wellness Officer for Kaleida Health. Today, our topic has been your brain and sleep, or the importance of sleep. It's been about the importance of sleep. So, I want to thank you for being our guest this morning in the Great Lakes Health Radio program. And in 2 weeks, we will have another wonderful program. And you know what? We may even repeat this program for those who didn't hear the program, because sleep is that important. And I'm Francesca Messiah, Kaleida Health Manager, Community Health Improvement. Thank you so much for listening to us. And when I see you in the community, I'm going to ask, is there a topic you would like for us to cover? And again, thank you, Dr. Adams. Bye-bye.